We have callers? Yes, indeed. We're backed up with callers. So let's take the first one.
Aiden?
Aiden, good morning.
Good morning, Barbara's team.
Good morning.
Good morning, Dr. Lord.
Morning, Aiden.
I was diagnosed with diabetic 2 years ago, and I'm on tablets and also insulin injection 4 times a day. For the last 5 weeks, I've been getting severe tingling, numbness, burning, and also electric shocks to the bottom of my feet. I stand that as diabetic neuropathy.
Yes, so
is there anything that can be done for it? How is it?
Yeah, although you were only diagnosed with the diabetes 2 years ago, it would seem to me that you were diabetic for many, many years even before that, although it was not recognized from the blood sugars that you may have had. It is known that several years before diabetes is diagnosed, the insulin insufficiency does occur. The high blood sugar that you would have had over that period of time and in the last 2 years would have affected the nerves, and that is what is responsible for the tingling, numbness, and burning that you're having in your legs. Now, what can be done about it is, of course, to keep your blood sugars as well controlled as possible. The other thing that should and could be done about it is that there's medication that can control this. Your doctor could prescribe this medication to help to control those symptoms. But is sugar control, diabetic control is important. Of course, exercise, which helps with the circulation to the area, also would be of a lot of benefit to you. But well-controlled diabetes is the key.
All right, we have another caller. Good morning. Welcome to the program.
Morning, Judith. It's Judith, I think.
Hello?
This doesn't sound like a Judith to me.
Doesn't sound like a Judith to me
Today is
either.
the men's man.
Apparently. Welcome to the program.
I think we just lost that caller.
But let's try again. Judith, are you there? Okay, we're having a bit of a
Doc,
issue.
when one of the callers was speaking just now, a thought came to mind, because there appeared to have been some serious concern in the voice. As a practitioner, is there a thin line that you walk as you try to allay fears and concerns but not alarm? How does that work?
Yeah, experience, and you take the patient into consideration and then make a determination how best to break the news of whatever news you have to do to think. But you have to be very, very firm and precise in dealing with patients and not joke around or lessen the impact where necessary.
So we have Judith back and we go to her shortly. So in other words, you don't go too far in either direction.
No,
if it's really serious, you don't.
You have to let them know.
Okay.
Yes.
All right, we have been steadfast and determined, and so has Judith, and she's back. Welcome to the program, Judith. What's your question?
Good morning.
Hello?
Good morning.
Let's try for
morning.
Timothy then. Good morning.
Hello, good morning.
Good morning.
Hi.
Morning.
Good morning, panel.
Morning.
Go ahead.
I have a question. I suffer with hypertension. I get a real severe pain around my heart area. Right? Checked the doctor many times with it. Say he see no blockage or whatever. I'm wondering if you could get a heart attack or anything without having high blood pressure or high cholesterol.
Yes, you can get a heart attack even though you may not have had any history of high blood pressure or high cholesterol. Sometimes there are people who have high blood pressure and not know, or high cholesterol and not know, but it's quite possible to have a heart attack from other causes. But going to your situation, you do have high blood pressure, and I hope it is well controlled. Having chest pain, and you say you have pain around the heart, you have chest pain, what you need to have done is to have investigations done. Electrocardiogram is one of the things that can be done. This is where they put the wires on the heart and check the electrical activity of the heart. But better yet will be a stress electrocardiogram, where you run on a treadmill and we see if under the stress of exercise there's any changes in that electrical activity of the heart. That will give us a clue. And of course, the definitive thing would have to be a catheterization, where they can inject a dye and look at those blood vessels and see if there's any narrowing of any of the coronary arteries, which are the blood vessels that supply the heart muscle.
Okay, hope
Hopefully
that was
that's
helpful for Timothy. We have another caller on the line. Good morning. Welcome.
Good morning.
Good morning.
Good morning.
Hi, Judith.
Yes, good morning.
Here she is.
Oh, Judith, we've been
Finally got
waiting
you.
for you.
I'm so sorry.
That's okay.
I'm calling. I have a 7-year-old daughter. And I know we've been told that children usually born with overdeveloped respiratory organs.
I'm hardly hearing you. Are you
Overdeveloped respiratory organs, hypersensitive, chest. Yeah, go ahead.
Okay, the area in the back of the neck or the throat where people usually say like your tonsils are inflamed, there is some little white stuff that comes up there constantly with a smell. I would like to know why they come there. What's up? Why they do that?
That is a exudate or debris which occurs in the tonsillar area, and that can be from food. It can be from a nasal drip coming from the sinuses that can cause it, and it can become infected and can be very foul smelling at some times and might need antibiotic therapy. But as far as the overdeveloped respiratory system, I'm not sure if what you mean is that she has a hyperreactive areas. This is like very sensitive to various allergens and dust and so on that you see commonly in asthmatics or persons who have a tendency for asthma.
Okay. Jordan's waiting as well. Hopefully that information was helpful to you, Judith, so you can take care of your daughter. Jordan, good morning.
Hi, good morning, Cassandra.
Hi.
Hi, good morning, Doc.
Good morning.
I'm calling about my period. I have been having some problems. Last month, it come for a whole month. So I went to the doctor, and he gave me some tablets.
Yes.
He gave me 10 tablets, and he told me to take them for 10 days.
Yes.
And the first time I take it, my bleeding did stop. And after the 10 days passed and the tablets them gone, the next day my period come back.
Yes.
And from that it has been bleeding. And I went back to him and he gave me 21 tablets to take. And I take the 21 tablets and the bleeding have not stopped.
Yes, what you have is what's called dysfunctional uterine bleeding. It's really a hormonal problem. Your hormones are going a little haywire. I'm not sure of your age, and I don't want to ask you your age, but it can happen at either extreme. Usually happens when the periods first start coming or near menopause, but it can happen in between as well. The 10 tablets were progesterone tablets, which is a hormone to try to regulate the periods, and they did work. And the 21 tablets, then he gave you the estrogen to try to see if that will help the problem, since they returned after having taken the progesterone. What he will need to do is do a combination of both, or evaluate you further, even with the DNC, which is a dilatation curettage, take out some of that endometrium and make sure that there's not something wrong going on with the endometrium, which is the lining of the womb, and then treat you accordingly.
We have Donna holding, Doc, but as a follow-on to the question the caller asked, how much should you pay attention to your cycle where your weight gain and loss is concerned? Because you know that with the retaining of water, you can go up at sometimes like nearly 5 pounds.
Yes, yes. You're talking about weight gain that happens just premenstrual?
Yes,
yeah,
yes.
Yeah, that is premenstrual syndrome, where you get edema or swelling just before, fluid retention just before the period, and that tends to go. But sometimes people become irritable and other things and bloated, and they may need to be on diuretics at that time.
All righty, we need to say good morning to Donna, who is holding. Good morning, Donna.
A pleasant good morning to you.
Good morning.
I have a question for the doctor.
Go ahead, please.
I've never been diagnosed with having a heart condition, but I find that I can't run a whole lot because I find like I get like a very sharp pain in my stomach.
Yes, chest. In your stomach or chest?
In my stomach.
Okay.
In my chest, sorry, not
Chest.
stomach. Sorry,
Okay.
yes, in my chest. And I find that even sometimes if I get too worked up, like say I get in a little heated argument or something like that, I experience some really funny pains in my hand. And I find that even last week, I had a little trauma with just a family member and so on, and I had this pain in my hand, and now I find it won't go away. And then I look to realize that I'm seeing like a red clot. I don't want to say it's a blood clot, but I'm just seeing a red mark in my hand which won't go away. So I just wanted to think it has anything to do with a heart problem or something like that.
Just jokingly, that clot didn't come from cuffing somebody, slapping someone.
That's the second time I've noticed it.
Yeah.
You see,
No.
it depends on the period in my hand or in my leg.
And after a stressful situation?
Yeah.
Yes. Like if I get too worked up, you know.
Okay.
Yeah, that is probably stress-related chest pain. That is unlikely to be cardiac. If you notice that whenever she's stressed, this thing does happen. However, she should get evaluated, electrocardiogram, of course, physical examination, electrocardiogram, and if even bothersome, stress electrocardiogram, which would rule out this. And then she needs to learn how to deal with stress. to prevent this chest pain from occurring and recurring.
What about the walking? Can she do
Oh
it
yes,
there?
yeah. Oh yeah, the walking and the tiredness after walking, that might be stress related as well. Well, exercise related, and it's commonly seen in persons who are exercise-induced asthma, where sometimes after 6 to 8 minutes of physical activity, they do get chest pain or shortness or fatigue. On relaxing, it settles down, and it can be easily be treated by use of the asthma inhaler before exercise.
Okay.
All right. At the moment, we are coming up to time for take our break, but before we do that, we're just going to remind you that you can send your questions to Facebook or call us on 228-5562, 228-5563. We're going to take a commercial break. We'll be right back.